Hi everyone, this is the Real Deal Sex Ed, and today I wanted to talk with you guys about the sexually transmitted infection known as chlamydia, which is another one of the more common, similar to that of gonorrhea. It can be spread vaginal, anal, oral sex, unprotected sex. If you're having sex with a male, even if they don't ejaculate, cum, nut, whatever you guys use, you can still get the infection. As with most STIs, protection barrier method is the main way to protect yourself against this infection. A lot of times for this one, you do not have symptoms, as with a lot of other STIs, including gonorrhea. The symptoms are pretty similar if you do, however. So for women, it can be abnormal discharge, burning during urination. The same for men, discharge from penis, burning during urination. But they can even have painful or swelling of their testicles. For anal infections, rectal pain, discharge, bleeding. So basically, you would need to speak with your healthcare provider, talk to them about whatever you're participating in. As I've said in many other ones, they can tell you if they feel like you need to test. If you feel like you need to test, you can always ask yourself. You can go to the health department and get your STI screenings as well. So if you are infected, there are two methods. There's a one dose method. That one, you should wait 7 days after that dose before you participate in sex again, and you make sure that your partner has been tested and take the medicine as well before you interact, because obviously you can pass it back and forth, back and forth, back and forth, because even if you're treated, you can still catch it again. The other one is a 7-day dose. So once you take that one and you are cleared and your partner is cleared, then you guys can participate in sex again. If, that is your partner and you're still with them, if it was a one night type of thing, then you should be good. It says here that you should get tested again for it in about 3 months after you finish your medicines. So, just take that and make sure that you're practicing safer sex practices after that if you are diagnosed. If you've never been, this is good information for you to know for the in case. As far as women, it seems that it can be more detrimental for us as far as things that happen later. So sitting in your body, you're not getting tested, or you just don't know that you have it because you're symptomless. It can cause reproductive issues such as infertility. And if you do happen to get pregnant, you're at a higher risk of having ectopic pregnancy, which is basically pregnancy outside of the womb. So that could be in the fallopian tube, things like that. Though that's a very, very, very serious case of pregnancy. And yeah, that can really cause some issues. People can die from ectopic pregnancy because obviously it's not growing in the space that it's supposed to. Your fallopian tubes cannot expand as much as your uterus would, so it can cause it to burst, which is detrimental. Again, and the other is basically being infertile, so you cannot have kids. I will say that if you are pregnant and you do find out that you have chlamydia, obviously your healthcare provider would know, because they run those tests kind of like at the beginning and in the middle. Like if you already know, they can try to get you treated for it. But if passed to your child, it could cause things like eye infections, pneumonia, things like that. So you want to be sure that you're being cautious of that as well when you are pregnant. So this is the Real Deal Sex Ed at gmail.com. Questions, comments, or future topics.